Thank you very much, Lou, and for those of you hanging in with us here. I'd like to talk a little bit about the Cancer Society's programs for businesses to reduce costs and improve productivity and through a healthier workforce. Our new branding model is that we're the official sponsors of birthdays. By reducing cancer, we help Americans achieve more birthdays. Okay, so our program of workplace solutions consulting with small businesses and large businesses is designed to help reduce and manage healthcare costs, increase productivity, and retain, attract, and in fact motivate employees. We have a series of different consulting opportunities with businesses to try to help them design benefit packages, healthcare or work site policies, and so forth to improve their employees' wellness and save themselves costs. So essentially what we have undertaken, and we do this with hundreds of businesses all over the country, is to work with them on designing benefit packages and policies to reduce their costs and improve their employees' wellness. Prevention reduces the occurrence of chronic disease. Cancer is still the #1 killer of people in working ages, and therefore it's a huge cost for medical treatment, obviously. And so therefore, by reducing the incidence of cancer, and coincidentally, most of our programs are designed to reduce or have the effect of reducing the incidence of heart disease, stroke, and diabetes, as well as cancer, you reduce costs tremendously. You also enhance productivity and improve the work climate. Just a couple of examples: by providing a benefit package which provides full coverage for all recommended screenings, colon, breast, cervical. We'll leave aside the current controversy about breast cancer screening with the National Task Force, but you have a 10 to 15% increase in the use of those screening exams, which does in fact pay dividends later on by catching cancers early or conditions before they develop into cancer. Providing full coverage for tobacco cessation, for instance, leads to a 10% increase in utilization of tobacco cessation products and quit rates. 45% rate increase in quit rates on tobacco by offering tobacco cessation telephone counseling. In other words, offering your employees an opportunity to get on the phone with a counselor trained in helping people quit and have access to medication, the patch or other things, increases the quit rates by 45%. That's practically the most significant thing you can do to control healthcare costs. Around $3,800 per year is the increased cost associated with a smoker's being on your payroll. Things that employers can do. We offer employers a package of different things. You can, as I said, improve your tobacco cessation programs, encourage physical activity, simple things like putting a point of decision sign at a stairway or elevator, take the stairs instead of an elevator. That done well increases the number of stair climbs for employees by 50% or so. Other things to encourage healthier nutrition, changing your cafeteria options, directing people toward healthier foods, and cancer screening and care I talked about before. There are different categories of business practice. #1, designing your benefit package. I already talked about that, making sure you cover tobacco cessation, screening rates, and so on. Then policies on nutrition offerings, encouraging physical activity, encouraging people to use gyms and other exercise opportunities. Programs for weight reduction, for instance, developing an employee-wide or company-wide operation to encourage weight loss over a year's period, a competitive kind of thing like we do at the Cancer Society with our employees and many other companies do. Tracking exactly what employees are doing, the changes over time. It's a great way to help people understand the benefits of doing that and also improve their rates. And then communicating with employees. Just having a benefit to get, let's say, colon cancer screening at the age of 50 doesn't guarantee somebody does it. The biggest promoter of screening is a physician telling the individual they should go do it. And the combination of a company, employer, and insurer and physician together drives those rates sky high, and we've seen that in New York City with many companies. The Business Group on Health does that, similar kinds of projects with companies. There are tremendous payback for that sort of thing. So there are, essentially, with the result we hope to achieve is that through employer practices and benefits, policies, programs, and so on, you drive down tobacco use, you drive up physical activity, end up with healthier eating and stronger preventive care, which results in less cancer, less heart disease, better health, controlled cost, and increased productivity. What's not to like? Thank you very much.